Wolf, who's a cosmetic doctor specialising in aesthetic, plastic and reconstructive surgery. There's a great excitement on the island because you're going to be opening a new practice here in Mallorca, is that correct?
That's correct. It's an honor for me as well, coming to the Isle, making a new practice here and see a lot of happy patients.
I mean, somebody like yourself who's top of the game, I mean, you've got 3 practices in Austria, you're a specialist in all these different areas. What made you choose Mallorca?
It's Austria and Germany. It's in Vienna, Salzburg and Munich. And we chose Mallorca, or the Palma de Mallorca, as a special or a luxury brand or offer for our patients. It's of course the local patients that we treat here, and a lot of people from Europe, from Germany, from Austria. They come here, have their homes here. They travel for the summer times, they travel back, and it's those patients as well. And for the third part, it's an offer for our patients, mainly in the metropole areas like Munich or Vienna. They want to go out and have their operation somewhere else, like medical tourism, and they want the healing and the holidays after the operation, and seek for a quiet reconvalescence and get some holidays, and then get back fresh to work, to their families, to their friends.
So they basically come here on the holiday, yes, and they go back to wherever looking amazing.
They get their well-being here, their treatment here, their operation here, yeah, and they get their recovery time, and then get back into their lives in families and work, very, very relaxed.
So you're a general practitioner. What made you want to specialize in the cosmetic side of things?
Actually, I'm a general practitioner and a plastic surgeon, so double board certified. Okay. And it's just, I very, very early knew what I want to become afterwards. So it was a school time where I knew that I want to become a plastic surgeon, specializing aesthetics. And it was part of a great goal and a long, long way of hard learning, hard work. And as a general practitioner, you complete what you don't can do in plastic surgery, because we human, we are full or biopsychological individuals. It's not only that maybe if you take the nose, it's a correction of a hump. You have deeper conversations with the patients, deeper conversations about problems. Maybe other organs don't work right now very well for an operation. You have to treat them before, right, and it's you complete the whole treatment of the patient. And that's why I choose a general practitioner for first, and then of course, but it was the long goal in the long run to become an aesthetic surgeon.
So how long have you been working in your field for now? For
aesthetics, or for plastic surgeon, specialized aesthetic surgery, it's about 6 years, and private practice actually one year.
Okay. So what do you enjoy most about the treatments that you offer people? Obviously there's a whole scope there, with plastic surgery, from full facelifts to people who maybe just want some Botox or filler. What do you personally enjoy about your work?
It's always like depending on the cases. I enjoy, of course, the operation, but I also enjoy minimal invasive treatments. Patients, they get younger today. They look for prevention. They get minimal invasive procedures, peelings, Botox, fillers, and facial rejuvenation. And then it's like a pyramid. Afterwards, you go for an operation. I do also thread lifts. And specializing fields are, of course, the facial rejuvenation, the facelifts, the correction of noses, and the breast.
Do you think, do you see more and more younger patients who are coming for preventative treatment? And do you think that's a good thing? Obviously, there's a lot of pressure in the media for young girls to look like certain celebrities, maybe like Ariana Grande. Do you find that you're getting younger girls who may come who want to look like somebody specifically? There's a pressure on them, or is it more preventative that they're thinking, well, if I start with Botox, say in my 20s, you know, I won't need to maybe have more invasive treatment when I'm older?
Actually, it's both, and that's true. It's the woman that wanted to have a fresher look and wants to prevent getting wrinkles. And on the other side, there's of course a true pressure from social media, look like an idol. And we all know that the Kardashians are, as well as the sisters Hadid, they dominate the social media, especially Instagram. And people are following, people want to look like them, get the V shape they use in the face, and want to look like them. And there's a lot of pressure to them in the community, in the social community where they are. And but this also could be a very dangerous thing, following idols.
Yeah. Because it's great if you can have a treatment that's going to boost your confidence.
Yes.
But there's also, you've ultimately got to be happy with the way that you look. And we all want to make the best of what we've got, which is why your industry is, you know, booming. You offer a lot of state-of-the-art machines. What kind of treatments do you offer that aren't particularly invasive, that may be new to the market?
In Vienna, we have you wanted to spot it on the Morpheus. The Morpheus is a device it's radio frequency combined with microneedling, and is a minimal invasive procedure or device to strengthen the skin. Yes. Okay. And it's a very, very good device, just a step ahead, a true lift operation. So you get those patients or those women seeking for a refreshment in the face. You combine with biostimulating fillers and microneedling and the micro frequency to get a fresh look and tight looking skin, just before you really truly have to go into the operating room and do a lift.
So is that something that's really popular in Austria?
Yeah, it's popular. It's looking more and more, but you can use it for the body as well.
Yeah.
You can use it for tighten the abdomen or the thighs as well. And the needles are even deeper in the body than, of course, in the face. Yes.
Okay. So one of the things that we all want to know is, whereabouts is your practice going to be, and when can people come along and get your professional advice?
So we have the kickoff right now.
Yeah, great.
It's also combined with the event today, like a Botox event. And our practice will be in the Clínica Luz. It's a private clinica here in Palma de Mallorca, where we do the operation, where we do the appointments, where we do the consultations and aftercare. And we're looking forward to have a lot of happy patients here.
And so what treatments will you offer in the clinic in Mallorca?
All minimal invasive treatments, thread lifts, fillers, Botox, peels, and of course the operations.
So plastic surgery as well?
Plastic aesthetic surgery, body contouring, facial rejuvenation, correction of noses, and as well breast surgery.
So somebody could come to you for any kind of cosmetic treatment?
Yes, in those fields.
They might be interested in. Botox has been around for a very long time, as well as fillers, particularly fillers in the lips, which has been very popular for a long time. Are you seeing a shift where women are moving away from that and going for a more natural look, or do you think it's still very much a popular treatment to have?
It's depending on the patient. There are two strong movements. It's of course more a natural look. the people want to have, not those very filled lips. But there's also a special technique. Or women ask. It's they are called the Russian lips. It's a very high upper lip. Okay. It's a special technique, but it's two extremes: a natural and a very looking fully filled upper lip. It's Russian. So it's both. Either the patient chooses one or asks for another.
What would you actually say to somebody who maybe hasn't had Botox or filler and is considering having that treatment and is a little bit scared to go down that road because maybe they think once they start having these treatments, they're going to have to continue having the treatments? What would you say to somebody who's new to any kind of cosmetic treatments?
I go forward with those patients very gently. So maybe do just one region in the face. That those patients get to know how botulinum toxin is working, or even just use 1 milliliter in the lips or 1 milliliter in the nasolabial folds, just to get those patients know how it's gonna feel like with a filler, and then do the continuous treatments.
Because I mean, we've all seen some people who've taken it to the extreme out there with cosmetic treatments, which is enough to put someone off having that. If you were to have a patient who came to you who's already had a lot of cosmetic work done, how would you deal with that? When some people can obviously get quite addicted to having more and more, and maybe they don't need it, maybe they, less is more in what you do?
Of course, it's the addiction, of course.
Do you come across that quite a lot?
Yes. And you have to talk with them that more treatments, it's not very useful and could be also very dangerous. We of course have seen a lot of extremes, but it's the difference between the USA and the Europe. Patients look for different results. In especially America, they look for the biggest bang for one buck. They look for nice breasts, big breasts. The European women also look for very natural contour of the breast. This was dominated these extremes in the last years, and now there's a new Hollywood movement in the US, and they want to also look natural.
Right.
So they got away from those extremes. They want to have a healthy, natural look. Operation, yes, yeah. But it should be a natural look, also in the face. It should be look quite good, contoured naturally, and keep the individual of the patient, so not change too much.
Yeah, so it's moving away from that frozen
yes, it's
face
moving away
look. People
from
want to look
the very
natural.
XL breasts, and it's moving away from really extreme lifts to more natural beauty.
There was a treatment, and which sounded quite interesting actually, and I'd never heard about it, about women, well, might not just be women, it could be men, who have Botox injected into their feet to get rid of the pain, especially if they wear high heels.
Right.
Is this something that you offer?
Yes, and by the way, it works great.
Yeah?
It's true. Because we all come out of Corona lockdowns.
Yeah.
And women wanted to show their dresses
again.
We've
been in trainers
yes.
for the last 18 months.
And wear nice shoes again.
Yeah,
because
absolutely.
In the lockdown we also ran around with joggers.
Yeah,
with
that's so
jumpsuits.
true. That is so true.
So you want to go out with your high heels, with the nice shoes and wearing nice dresses, and to go to parties and visit people again. And of course, wearing high heels can be very painful. It's an unnatural situation for the foot to just stand on the ball of the foot, and this is the pain is triggered through those muscle. It's a muscle pain there, and you can very treat it good with relaxation through Botox.
Yeah,
and so it's working quite good.
So it's not just about making people making people look better. There's also a practical
the
sense.
feet don't look better.
Yeah.
But it feels very better.
There's no pain in your face if your feet aren't hurting.
Yes, but it's also that it's a very short distance until the results are, because if you use Botox in the face, the results or the smoothness of the muscle will last a week, but it's shorter for the feet.
Yeah. Do you think there's more and more pressure on women to look perfect than there ever has been?
Yes, it's also the job markets, a lot of unemployed people, and it's always been there, and it's always in the mind of people that young or healthy or fresh looking people are the one that have the success. So it's always the combination of beauty and successful, or being successful. And of course, we are just a small part of this cake, supporting those opinions and doing the treatments. And it's a whole bigger industry than just us plastic surgeons, but that's true. People look for beauty, people look for looking healthy and fresh, and they combine it with successful life.
Yeah. If there was one woman who, in your professional opinion, looks like she's had any cosmetic treatment done, who you think looks better for her or fabulous, is there anybody that you
Yes, there are.
You would say is a great example of what you do?
On my Instagram account, I do every Sunday an analyzation of transformation of a celebrity. It's just my opinion, and it's very interesting because with the photos, the pictures of the celebrities, you have a continuous timeline, and you can see changes. And of course, I personally, it's the plastic or the results of the plastic surgery from Kate Hudson and Halle Berry.
Okay.
They're very, very good results, but there are a lot of more. And this is also where this could be dangerous, where we talked before, because others might think they have to follow those idols. And it's always a very, very individual case. Each patient is very individual. Just because a celebrity looks very nice and you follow her, also for treatments, it must have the same results in your body, in your face, whatever.
So you've treated celebrities as well as, just everybody else who might want to improve the way that they look.
Yes, at home we have a lot of patients, even celebrities, and they are also very normal person looking for a good treatment and a fresh look. And of course, there are a few among them.
I mean, ultimately, we all want to look fantastic, don't we? Or the best that we can. And with your help, obviously, that's something of a possibility. It's been fantastic talking to you, really interesting.
Thank you very much. Thank you.
Can't wait for you to open your practice and wish you all the success with it.
Thank you very much. I enjoyed it. And looking forward for great work here with a lot of happy patients, happy people, and do good conversations and networking.
Thank you. And thank you for watching In Conversation with Celebrity Magazine.